Hello. My name is Jones, and today we are going to look at geriatric syndromes. Okay, so in the first lesson, we looked at aging and diseases. Now, this is our second lesson in our geriatric care program, where we are looking at geriatric syndromes. Okay, so it is important to know that aging is characterized by the progressive accumulation of damage at the molecular level caused by environmental and metabolic generated free radicals that spontaneously happen, and then we have errors in these biochemical reaction, and this may lead to free radicals moving around within our bodies that would then cause harm to our body and bring about a syndrome of diseases. So aging is characterized by progressive accumulation of damage at molecular level caused by environmental metabolic generated free radicals that comes from spontaneous errors in the biochemical reaction as one is aging, and also nutrition components. So we see certain changes such as gradual decline in glomerular filtration rate, gradual decline in hepatic oxidative metabolism, increase in proportion of the body fat, reduction in muscle mass generally occur as our body ages, or as part of ageism, aging process. So during the process of aging, a person becomes unprotected against diseases and injuries. This can be attributed to cellular and non-cellular changes that bring about decrease in the reserve capacity of organs and systems. A decrease in homeostatic control mechanism, and examples can include thermoregulation system defects and decreased baroreceptor sensitivity, and a decrease in the ability to adapt to environmental factors, and a decrease in the capacity to respond to stress that happens as one is aging, or that happens in geriatric age. It should be taken into consideration that the clinically important consequences of geriatric patients are mostly due to diminished physiological reserves, disease presentation. So you see that the disease presentation in adult becomes atypical of other adults or other people of geriatric age. We also see a compensatory mechanism that is weakened in the geriatrics, and also we see recovery from illness becoming slow in adults, or there is a slow immune response. So ageism brings about low immunity. Then there is also certain preventive measures, that are beneficial. And you see that we have a weakened reserve in geriatric patients, and this leads to greater risk for iatrogenic injuries, or injuries without proper traceable cause. So when we have such a situation, we end up having geriatric syndromes. We end up having geriatric syndromes, and when I'm saying we end up having geriatric syndromes, here I'm looking at a multifactorial health condition that geriatric patients may have due to involvement of multiple organs. Okay, so we have some key characteristics, but we also need to appreciate, okay, of these syndromes that affect the geriatric patients. You see sexual dysfunction, low motivation, problems with memory, okay, and we also see hot flashes and infertility. So this will happen in adulthood because of decline in physiological function. So what are the key characteristics that we see? Often these are triggered by multiple risk factors that act synergistically, okay, and they result in high morbidity and poor clinical outcomes because of their presence within the specified individual geriatric patients. So to manage these, they will require comprehensive assessment and an interdisciplinary care. Okay, so the major geriatric syndromes that we have may include depression, okay, may include polypharmacy, may include injurious fall, may include risk of fractures, risk of disability. Risk of disability can also include issues of, let's say, they have cataract, so there's risk of them losing sight. Okay, risk of fall will bring about disability. We also see urinary incontinence. Okay, we see other conditions, okay, or other non-communicable conditions like diabetes. We also see cardiovascular conditions, and we may also see a cognitive decline. So the major geriatric syndromes that we are going to discuss may include frailty, from the word frailty. So from the word frail, well, someone is frail, is weak. So frailty. So it's a biological syndrome of decreased reserve and resistance to stressor, is one of the conditions that we see in geriatric patient. Frailty, which is a biological syndrome of decreased reserve and resistance to stressors. The common features of frailty includes muscle weakness, fatigue, slow walking speed, unintentional weight loss, and we also see, in general, we see functional decline. How do we manage frailty? We can manage this with exercise. That is, passive and active exercise can help to manage frailty. Nutrition supports or supplements are there to manage this, and we also need to avoid falls. Because of frailty, there are risk of falls. It's okay. Then we have a condition that affects the cognitive system, or the central nerve, that affects the central nervous system, and that is delirium. Okay, so delirium is an acute disturbance in attention and cognition. So we see delirium, okay, in geriatric patient as one of the syndromes. The signs of this condition may include disorganized thinking, altered level of consciousness, and mostly this condition, when it comes, it comes acutely and it fluctuates. So it is of acute onset and may have a fluctuating course. The signs of delirium include disorganized thinking and altered level of consciousness as one of the syndromes and signs that can be seen Here in geriatric patients, we are talking of delirium, and the signs include disorganized thinking and altered level of consciousness. How can we prevent delirium? We can minimize on psychoactive drugs, and it is also important when these patients have been indoors for some time, you can encourage early mobilization, which may improve familiarity and return to sin. Orientation in activities may also help prevent delirium. Okay, so the other syndrome that we see in clients, in geriatric clients, includes falls. So how do we prevent falls? So we necessarily experience 30% of our adults having falls in some community dwellings. Of course, this is statistics from the literature that I've been using to prepare these notes. So about 30% of geriatric patients may experience falls. So it's important you clear their path that they have to move in because of flaity, which may predispose them to falls. It's important you don't have slippery floors. Okay, if you have a geriatric client, okay, it's important to give a support walking tool or assist with a support walking tool to prevent falls. So what are the risk factors to falls? It's weakness. Okay, the weakness that comes because of frailty. Okay, because the geriatric patients are quite frail. Then also poor vision. Okay, poor vision may cause them to knock themselves to things around them, and this will cause falls. And also decline in perception. Decline in perception or cognitive decline may cause geriatric clients, okay, may cause them or may risk them to falls. Okay, so vision impairment, weakness, and cognitive decline may risk our geriatric clients to falls. How then can we prevent falls in our environment? So we have to modify our environment to be risk-free or hazard-free. Okay. Strength and balance exercises can be done on our patients with flaity or weakness. Vitamin D for strengthening the bones. Okay, because they have weak bones, they risk having fractures. So vitamin D supplementation can help in geriatric clients. Okay, let us now look at another condition that forms the geriatric syndrome, which is urinary incontinence. Urinary incontinence, okay, is one of those common type of geriatric syndrome that we see. This comes because of the age that the patient may have and may have little control over their functional age to pass urine or to go to the toilet. So they may find it very difficult to go to the toilet, so hence they may end up messing in their clothes, okay, because of the weakness and also because of cognitive decline. Okay, so when you're talking about incontinence, simply soiling of one's clothes, okay, with fecal matter or urine. So that is what. So the common types come because of the age and function incontinence. What are some of the risk factors to incontinence? So as we have established, it's because our patient is frail, so we say flaty, dementia, high body mass index, okay, and use of physical restraints. These may risk these clients to start having incontinence. What is the impact of incontinence? It reduces the quality of life of the patient and may also increase falls. Okay, because a patient will feel compelled to try to rush to the toilet so that they don't mess themselves up. So there's increased risk of falls. So that is the impact. Okay, another syndrome affecting our geriatric clients is sleep disorders. Problems with sleep. Any sleep disorder, but it's sleep disorders. The cause can be because of the illness or can be due to multiple pain that they may feel within their body, and sometimes they tend to hold their urine until someone who can assist them is there. So find that they can only maybe go and pass urine in the nights when other people are around. Okay, so depression also will affect. Old people tend to reflect on what they have achieved in life or what they would have achieved. Okay, where did they necessarily make mistakes in life for them to find themselves in certain situation? So depression may set in. And sometimes sleep pattern disorders may come because of compromised cardiovascular system that affects breathing, or because of compromised respiratory function that affects their breathing. So you find that they have sleep apnea or they have sleep defects. What is the effect? What is the effect of sleep disturbance? So, or what is the effect of insomnia that we see? So we are going to see poor sleep quality in the elderly, okay, and this, if one is not having proper sleep, it affects their immune response. So if their immune response is affected, we see chronic diseases. And if one is not having enough sleep, we see cognitive decline. So those are the effects. Okay, so the other condition that we see is the malnutrition. Okay, as part of the geriatric syndrome, we see malnutrition. The cause of malnutrition in this situation includes dementia, includes depression, social isolation, and we also see some oral problems that geriatric patients face. So the geriatric patient will have maybe weakness within their dental cavity, which will cause them to fail to chew, and if they fail to chew, it will now affect their appetite. They can no longer enjoy food like they used to. So they are fearing that their teeth cannot manage to chew certain things. So it's like they will prefer pre-chewed food. They cannot handle bones. They cannot handle meat. Okay, so why? Because after eating, they will experience some pain. Okay, so here I'm talking about necessarily dental decay. Okay, so dental decay that happens in geriatric clients may cause them to be choosy with which foods they can eat. What are the outcomes? There will be increased infection risk, there will be longer hospital stays, and higher mortality. Okay, so geriatric patients, because of poor nutrition may lead to reduced immunity. And with reduced immunity, there is a decline in immune response. Hence, when they are admitted and nutrition is key for them to improve, it becomes very difficult. Okay, so what are some of the screening tools that can be used to diagnose malnutrition in these patients? So we have a mini nutrition assessment that can be conducted so that we diagnose malnutrition. Okay, so the other syndrome that affects patients with geriatric patients includes pressure ulcers. Okay, so pressure ulcers are localized skin and soft tissue injury that happen over bone prominence because of excessive pressure or long-standing pressure that is exerted on these areas. So find that there is impaired circulation and necrosis of tissue. So at the end, they develop pressure sores. Okay, what are the risk factors to pressure sores in our geriatric clients? Immobility, malnutrition, and incontinence. You need to know and understand that urea or urine, okay, irritates the skin. Okay, it irritates the skin. So once that is not removed or it stays there for a long, there can be exfoliation of the skin that will lead eventually to pressure sores. In talk of malnutrition, limited nutrients within the body will affect immune response, hence pressure sores coming in. Immobility brings about excessive pressure on a part of the body, and we know that blood carries with it nutrients. So immobility will cause pressure on the blood vessels to an extent that they fail now to supply blood to other areas, especially on the bone prominences. Okay, so on the bone prominences, and these bone prominences are areas through which blood needs to pass. So when blood passes, it will then feed the other area end of the skin with the needed nutrients. Okay, then how can we prevent pressure sores in these geriatric patients? So they can be prevented through regular repositioning or having a turning chart. Okay, so in this thing we talk of 2-hour turning chart for these patients, and also ensuring that these areas, if there is no presence of pressure sore, okay, they are stimulated or massaged to promote circulation. Then it's also important, if you have a pressure relieving mattress, you can make the patient lie on a pressure relieving mattress so that there is good blood circulation on bone prominences. So one of the syndrome also that the elderly will have or face is pain. This is pain of an specified region of their body, or pain in the joints, backache. So generally they are in pain most of the time. It's one part after the other. So there's a syndrome. This is part of the syndrome of our geriatric patients. So the types of pain that they may experience may be nociceptive, neuropathic, or it can be mixed. What is the impact of pain as one of the geriatric syndromes? It leads to depression. It may lead to depression and may also affect their ambulation, leading to immobility. May also cause reduced quality of life. Because they are always in pain. How then can we manage this pain? We need a multidisciplinary approach that may include physical therapy and pharmacological treatments. This is for simple reasons that these patients, they are also at risk of polypharmacy. They might be on a lot of drugs, and when you prescribe, at the end, they'll be taking a bag of drugs. So physical therapy can help, pharmacological treatment can help with these patients and relieve these types of pains that they may experience. So as mentioned, we have polypharmacy as one of the syndrome that we see in the elderly. Poly, many, now pharmacy to do with drugs or medicines. So polypharmacy is the use of multiple medication that may often be unnecessary. So you may find yourself in this position that these elderly patients may have 10 or 5 cocktails of drugs that they have to take. For this I take this, for this I take this. So a multidisciplinary approach can help. Supplements can help. Not just the pharmacological approach, but certain supplements may help to relieve pain or any other thing that these clients may be facing. So then what are some of the risks to do with polypharmacy? What are some of the risks to do with polypharmacy? So it may include increased side effects. Many are the times that when you go to the hospital, a drug can be prescribed, but to realize that the other effects that the patient is having may be due to the effects or the side effects of the drug that the patient is already on. This may not necessarily be diagnosed or be noticed. So we see this happening mostly in polypharmacy. So we see increased side effects, and if you are giving a lot of drugs, there can be drug interaction. Drug interaction can bring about synergistic effect, or can bring about negative or subtractive effect. You might find that you are causing other problems or diseases, or challenges in the patient because of the drugs that you have prescribed. The drugs that we prescribe to the patient may, for instance, predispose them to renal stones. The drugs that we give to this patient, they have a weak liver, so may predispose them to liver problems, and this then may lead to prolonged hospitalization, because the drug interaction that is happening has caused other diseases to come. You find that because they have a decline in liver function, even the liver in metabolizing these drugs will have challenges. What are some of the strategies that we can use for polypharmacy, or for us to manage polypharmacy? So we need to review regularly the drugs that we have put our patient on. Each and every time the patient comes with a new or complaints or may have new complaints, we need to review the types of drugs that they are taking, so that we know if we can remove some drugs from there, or if at all it is necessary for them to take a drug, or for them just to be on a non-pharmacological therapy like physical therapy. Okay, so it is also important, that we prescribe drugs that may also help alleviate depression in the patient. Okay, so if we prescribe the drugs that may lessen depression, we need to understand and appreciate that the beginning of our lesson we mentioned that depression is also one of the conditions that we see as part of the geriatric syndrome. Okay, so now we have talked about a lot of conditions that we see in as part of geriatric syndromes, and you may ask a question: why talk about geriatric syndrome? Does it really matter to talk about geriatric syndrome? Yes, it is important we talk about geriatric syndrome because older adults often have atypical disease presentations. Okay? That is for that simple reasons. They have atypical disease presentation. So the syndromes that these adults or geriatric clients face are interconnected. Okay, you may find that falls may lead to delirium, or falls may lead to pressure sores. So, as a healthcare personnel or patient or healthcare individual that is taking care of these patients, it's important that you have got a good history of these patients, and you have to kindly note these syndromes, how they can be related based on the presenting signs and symptoms that the patient has. So it makes it important that we have to talk about geriatric syndromes. So early identification of these syndromes, the geriatric syndromes, can help prevent functional decline and institutionalization that we see. If you detect certain things early, it will help you to bring about the decline that we see in the geriatric clients. You need to institute a measure. Okay, so when you have instituted these measures, it now acts as a remedy preventing that decline. Because at the end, these geriatric patients find themselves institutionalized because there was no one to put up a remedy. Okay, so now let us now appreciate comprehensive geriatric assessment. From what we have talked about so far, it's important to appreciate that aging affects all systems of our body. So as we are assessing these clients, it is important that each and every system is assessed for a reduction in function. That is, if it is possible in your clinical setting. Okay, each and every part of patient's body, the gastrointestinal system is affected, the immune system is affected, the respiratory system is affected. So a comprehensive geriatric assessment can be done. What is the purpose of doing a comprehensive geriatric assessment? This is to identify medical, psychosocial, and functional issues that the client may be having. So you can do a cognitive assessment on this patient. This is to rule out diseases like delirium that affects the cognitive system. So you do cognitive assessment or you do a mental health assessment. You can also look at functional status to do with activities of daily living. This is for you to establish if at all they might need some kind of aid that should help them in everyday life to lessen the decline that is happening because of age. You need to assess the functional status of their activities of daily living to rule out the need for any aiding tools that the patient may need, okay, to help improve their functional status. Or it will help you to know which instrument they can use in their activities of daily living. So when you do a functional status, it helps you establish an instrument that they might need in their activities of daily living. You also need to do a mood and depression screening, because we have said the depression is one of the syndromes that we see in these patients. Nutrition assessment, because we have said malnutrition is one of the common conditions that we see in these patients. So patients find that they lose mass of the muscle. Okay, so you need to do a nutritional assessment. Medication review, this is to rule out polypharmacy, and this is to protect them from the risk of polypharmacy or risk of taking too many drugs that may adversely affect their health. You also need to assess the mobility and balance. This is to rule out falls. Patient may fall. This is also to rule out frailty, to rule out that the patient is not frail. Okay, so you also need to do a multidisciplinary team assessment. Physicians can do the assessment, okay, to establish what this patient may have. Nurses may also do their own assessment to establish what the patient may need, and also social workers, because the diseases that affects the elderly is not only those non-communicable diseases. Some of them are those diseases that might need a social worker to help them network with organizations that can support them. Okay, so the summary of this lesson is that maintaining well-being and quality of life in an aging population is often accompanied by significant social and economic difficulties. And the main aim and goal of you doing geriatric care is that you have to be there to help those people that are aging within our community. Hence, the growing need to create new policies in each and every country, because we have viewed in the past that the problem of having a huge number of people who are aging is only for the developed countries. But we are also seeing a similar trend where we are also having a lot of people that are aging in developing countries. So there is a growing need to create new policies and strategies that can increase the welfare of our aging population, especially considering that there is a very significant difference in terms of expectancy at birth between developed and developing nations in the current century that we are in. Okay, so there should be societal modification that should be done. This is mainly to developing countries that are still viewing as a problem of aging being only for the developed countries. So Our country needs to have geriatric specialists. Almost each and every one of us, we have had an opportunity to nurse or to take care of patients that are old or that are above 65 years. When we learn about geriatric care, it helps us to enlighten us to know some of the problems that they face that we might have missed. Okay? So from me, I'm saying thank you and keep studying.